my name is Cindy and I'm one of the nurses here at Madnani Facial Plastics. Today we'll be doing a quick video on what to expect when you come in for a wrap change after surgery, so that's post-op day 1. So here we have our wonderful patient, Patricia. So she just got a facelift neck lift, and this is the wrap that she's going to come in with. It's the wrap that we put on after surgery, and it's going to be a little bit tight, but the next day patients come back to get a wrap change, and from then we're going to put on a much lighter dressing. Okay, so I'm first going to cut off this wrap. Okay, so at this point, Patty's wrap has come off, and usually when patients get facelift, neck lift, they have a couple of incisions. One is going to be in front of the ear, so with the Q-tip, I'm just going to trace, it's going to be here. There's going to be one behind the ear as well, and that goes the same for the other side here. So 4 incisions total, one front, one back, front, back, and then if they're doing a neck lift, you're going to have an incision here as well. So at this point, after the wrap is off, I'm going to assess your incisions to check to make sure everything's okay, that everything's healing nicely, and then I can clean the incisions. Oftentimes there's a little bit of scabbing and crusting at this stage. So we take some sterile water and sterile Q-tip, and then just for demonstration purposes, I'm just going to pretend, but I'm going to clean the incisions here. And when you go home, patients are instructed to clean with Cetaphil, basically the most gentle cleanser without any added ingredients, and you're going to do this twice a day. After washing and cleansing, next we're going to apply antibiotic ointment over the incisions. So here is my antibiotic ointment, and we will prescribe you one during your pre-op appointment. So I'm going to apply the antibiotic ointment, just a very thin layer over the incision. So incision front, back, same thing on the other side, and then under the chin. So now that the antibiotic ointment has been applied, next I'm going to seal it with Aquaphor. So the Aquaphor just provides a second layer of protection. It's actually going to help the gauze stick on, and we're going to show you how to put the gauze on next. Now that the antibiotic ointment and the Aquaphor has been applied to the incisions, next we are going to cover the incisions with gauze so that we're going to keep it protected and clean, and so that there's nothing else other than the gauze rubbing against the incisions. So with the gauze, we take a 4x4, we fold it in half, and then with the folded side will go towards the incision, meaning that since she has an incision here, it's going to go here. Patty, just hold that for me. So towards incision, and then same thing with the other side. You fold the 4x4, and then the folded part will go behind the ear, like that. And if you're doing this properly and correctly, it should kind of just look like a butterfly. So now that the gauze has been applied over the incisions, next we're going to apply a new wrap, and this we actually give you at your pre-op appointment. This wrap is much lighter, much stretchier, breathable, and more comfortable for the patient. The most important thing about applying this wrap, however, is that when you do apply it, make sure you're not putting it perpendicular to the chin. The reason is because if Patty moves her head, it's actually going to it can tear her skin. It's going to be very painful and just very abrasive to the neck skin. So when applying this wrap, make sure you're applying it against the neck and not directly under the chin. So it's going to go like this. And if you can see what I'm talking about, this wrap, the edge of the wrap is not perpendicular to her neck. It goes flat against this whole area. And then so you just want to apply this wrap. You want to make sure it's covering all of the gauze, and it should be not too tight. You should still be able to fit about 2 fingers in between the wrap. However, you don't want it to be too loose either, because then it will defeat the purpose of the wrap compressing the entire area, which helps with the swelling. So feel free to adjust the wrap as needed if you need to move it so that all the incisions are nicely covered. So at this point, Patty's clean dressing has been applied, and we want you to do this twice a day. So if you want to go home tonight You can take it off, take a shower, but be very careful when you're taking a shower. Please refer to our FAQ page for more detailed instructions on how to properly take a shower after getting a dressing change. And then after this, we'll see you in 1 week for your suture removal.